Are you suffering with low back pain and have been diagnosed with degenerative disc disease? Have all your previous attempts at finding relief been unsuccessful? In this video, I'll share with you how I help people with degenerative disc disease overcome their back pain. Hi, I'm Dr. Jared Obrink. I'm a chiropractor and a certified McGill method provider. I help people overcome their back pain even when nothing else has helped, so that they can get back to living without having their lives dominated by back pain. Before I explain to you how I help people with degenerative disc disease overcome their back pain, I'll first explain what degenerative disc disease is and why it can cause back pain. To understand what degenerative disc disease is, it can be helpful to first understand what a healthy spine looks like. As I'm sure you're aware, your spine is made up of a series of bones called vertebra, separated by discs. So if we were to look at your spine from the side view, this is something like what it would look like. We would have the bones or the vertebra interspaced with the discs. Now in a healthy spine, what you'll notice is that the disc is nice and plump. There's no narrowing of the disc space. The inside of the disc, the gel part, is well hydrated, so it hasn't started drying out yet. There's no bulging of the disc past the front or the back of the vertebral bodies. The end plates, so the top and the bottom of the disc, or the top and the bottom of the bone, is nice and smooth. The back of the bone is nice and flat. There's a nice amount of joint space in the joints or the facet joints at the back of your spine, and the opening that your nerve passes through is unobstructed, nice and clear. There's lots of room for the nerve to come through. And you'll also notice that the two bones are stacked nicely on top of each other. If we were to compare that to a spine that has disc degeneration, what we would notice is that the disc has become flattened, the disc space has narrowed. You'll also notice that the gel in the middle of the disc is starting to dry out. The disc will also be bulging in front of or behind the vertebral body borders. There could also be some tears in the outside rings of the disc. The top and the bottom, or the end plates, will be irregular and jagged, not nice and smooth. You'll notice that the back of the vertebral bodies is no longer flat, but now there's bony growth called bone spurs or osteophytes that are growing. Because the disc space is narrowed, the joint space in the facet joint will also be smaller. And because of the bone spurring and the disc bulging, the opening that the nerve passes through will also be obstructed, which could result in compression on the nerve. And although I haven't drawn it on this picture, what could also happen at the level of the degeneration is that the top bone slides forward or backward compared to the bone below it, so they're no longer neatly stacked on top of each other. So as you can see, there are a lot of changes that can be associated with degenerative disc disease. And as a result of that, there are actually a lot of different causes for why degenerative disc disease can hurt. Some of the more common reasons are that once the disc becomes flattened, that level of your spine loses some of its natural stiffness, and so now you're more likely to have painful micro movements where the one bone slides around more easily on the bone below it. Or because the disc has become flattened, now there's less space in the facet joint, and so that joint carries more load and it's more likely to be irritated. Or because the disc has lost some of its height and some of the internal pressure has decreased, now pain sensing nerves can grow into that disc and the disc can be more sensitive. Or because of the disc bulging and the growth of the bone spurs, which compress on the nerve, now the nerve can be painful and uncomfortable. And so you can see there's all kinds of reasons for why disc degeneration can hurt. It could be the micro movements, it could be the increased pressure in the facet joint, it can be compression of the nerve as it exits, or it can be that the disc has just become more sensitive. And therefore, to successfully treat degenerative disc disease, you have to know more than just that you have degenerative disc disease. You also have to know which of these different causes for why degenerative disc disease can be painful is the reason that you have pain. And as a certified McGill method provider, that's exactly my approach. So when someone comes to the clinic suffering from low back pain and have been diagnosed with degenerative disc disease, I have to figure out exactly why they have that pain. So is it from the facet? Is it from the disc? Is it from the nerve? And then once we know why the person has pain, we can address that specific cause. This is often done by modifying their postures, their movements, or their activities to minimize the stress that is placed on the irritated or the painful structure. So let's say, for instance, that you had pain. The pain you have with your disc degeneration is associated with loss of stiffness or some movement, some extra movement at that level. And so since your spine has lost some of its normal or innate stiffness, then what I would do is teach you how to use the muscles of your torso as guide wires, to tighten those guide wires, to use the muscles to stiffen up the spine to get rid of those painful micro movements. Or if your pain was a result of too much pressure coming from through the facet joint, then I could show you how you could adapt your postures or your movements to decrease how much pressure you're putting through the facet joint to allow the irritated facet joint to calm down, the pain to resolve. And then once we have the pain resolved, then the last step would be to increase the robustness and the resilience of your spine through various exercises to ensure you have the access to the broadest range of pain-free activities possible that is necessary for your daily life. So to summarize all that, disc degeneration can be painful for a variety of different reasons. And therefore, if you've been diagnosed with degenerative disc disease, you have to determine which specific cause is responsible for your pain. And then you have to address that specific cause. You can't just have some general one-size-fits-all approach. You have to address the specific cause for why you have back pain. And then once you do that, the irritated tissue can heal, the pain can resolve, and you can feel better. And so if you're interested in having me help you to overcome your low back pain, then I encourage you to get in contact with us by clicking on the link in the description box below. If you know of others who may benefit from the information in this video, please share this video with them. If you have any questions, please leave them in the comment sections below. Otherwise, please subscribe to our channel and like this video. And as always, thanks for watching, and I'll see you next time. Take care.